Understanding fetal heartbeat absence, signs, symptoms, and outcomes.
Hello and welcome. Today we're going to explore a rather serious topic, that of fetal heartbeat absence during pregnancy. Pregnancy is a complex journey, filled with excitement and anticipation, but also sometimes accompanied by concerns. One of the biggest reassurances for expecting parents is the presence of a healthy and regular fetal heartbeat. When this heartbeat cannot be detected, it's natural for worries to emerge. Today, we will discuss the signs that might indicate an absence of a fetal heartbeat and the possible outcomes for the pregnancy.
What are the signs that indicate an absence of fetal heartbeat?
An absence of a fetal heartbeat might not have obvious physical signs or symptoms, especially in early pregnancy. However, there are certain indicators that might hint towards this condition. 1. Lack of pregnancy symptoms. Pregnancy is usually accompanied by certain symptoms like nausea, breast tenderness, and frequent urination. If these symptoms suddenly disappear, it could potentially indicate a problem. 2. Vaginal bleeding or spotting. While light spotting can be normal in early pregnancy, heavier bleeding might be a sign of a miscarriage. 3. Cramping or abdominal pain. Severe abdominal pain or cramping might also indicate a potential issue. It's critical to remember that these symptoms could have various other causes, and their presence doesn't necessarily confirm a fetal heartbeat absence.
How is an absence of fetal heartbeat confirmed?
Healthcare providers usually confirm the absence of a fetal heartbeat using medical equipment like an ultrasound or a Doppler device. These tools allow for visualization or listening to the fetal heartbeat. A heartbeat is generally detectable around 6 to 7 weeks of pregnancy. If the fetal heartbeat isn't detected at an expected stage, your healthcare provider may conduct a follow-up ultrasound after a week or so, as it's possible that the dates of the pregnancy have been miscalculated or the fetus is developing slower.
What are the possible outcomes for the pregnancy?
If the absence of a fetal heartbeat is confirmed, it usually indicates a miscarriage or a stillbirth. 1. Miscarriage. This refers to a pregnancy loss before the 20th week of gestation. After the loss, the body may naturally expel the pregnancy tissue, or medical intervention might be needed. 2. Stillbirth. This is a loss of pregnancy after the 20th week. Stillbirth often requires medical procedures to safely remove the fetus from the body. In both scenarios, it's crucial to provide both physical and emotional care to the individual experiencing the loss. While the absence of a fetal heartbeat can be a distressing situation, it's important to remember that it's not always preventable and is in no way the fault of the parents. If you are experiencing any symptoms or have concerns about your pregnancy, always seek immediate medical attention. Pregnancy, despite its occasional challenges, is a journey, and every journey has its ups and downs. Stay healthy, stay informed, and always seek the help and support you need.